Hello everybody, welcome back to another live stream. Hello everybody, welcome. My name is Ollie. We are doing some medical terminology today. I have about 60 questions for us. I have some prefixes for us. I have some word roots, and then I have some of the medical suffixes. How's everyone doing today? Happy Thursday. Hello everybody. Welcome. Welcome to the live stream, everybody. Hello, welcome in. Hello everybody, I'm Ollie. I go live multiple times a week on TikTok covering A&P topics and some other topics that you guys do request. Today we are doing some medical terminology. I think learning and acing your medical terminology. Hey Kylie, how you doing? Or Kyle? Is it Kyle or Kylie? There's multiple E's. But hello. Welcome everybody. Hello. We're going to get started here once a couple more people join, but welcome in everybody. You guys are awesome. Hello. Thanks for joining. Thanks for liking the live. The more that you guys do like the live, the more that it'll get out to more people. We can help out as many people as possible on their upcoming anatomy and physiology this semester. Really hammer down the medical terminology today. That's what we're working on today. Again, we're going to go through the prefixes, we're going to go through the word roots, and then we're going to go through suffixes today. Again, learning and really acing your medical terminology is really going to help you in your future success in your courses, especially in the medical side of things. A lot of times, if you just know the definitions of words and understand the terminology and its language, you can really answer a lot of questions based just off of that sometimes. So that's why we go over this in pretty good detail, and I try to cover this information every so often. I'm actually going to be making a YouTube lecture series on medical terminology. I've uploaded the first video for that on how to read the terminology. The next one that's going to come up is going to go into prefixes in depth, word roots in depth, and then suffixes in depth. And then we'll probably have some practice. But this is also going to be a great practice reference for you as well. I upload the replays to YouTube. But we'll go ahead and get started. We have a lot more people in here now. Hello, everybody. Welcome. My name is Ollie. I go live multiple times a week covering anatomy and physiology. Hey, beat-ups. How you doing? I go live multiple times a week covering anatomy and physiology topics that you guys request. We normally do A&P 1 on Mondays, A&P 2 on Tuesdays. Today, we're really focusing on medical terminology. When you understand your medical terminology, it really gives away a lot of the answers in anatomy and physiology especially. I just want to thank you, before we get started, I just want to thank you guys so much again. If you joined yesterday, I got an interview by TikTok about what I kind of do here on TikTok, so great stream. Thank you. Hi, everybody. Hello. Hey, Marie. How you doing? How you guys doing? Hello, Maria. How you guys doing? Hello. I'm just looking at your comments. We'll go ahead and get started here in just a moment. I'm going to let a few of you more join. Thank you. Congratulations. Thank you so much. I appreciate you. You guys are awesome. But hello, extra big thank. Hello, beat-ups. Hello, Maria. It's good to see you guys. I hope you're doing well. I saw you earlier, Maria, our tutoring session. But let's get started here, everybody. We have some medical terminology. You guys should crush this, but if you haven't seen it before, we are going to get you prepared. Calling people already asking. Hello, Joanne. Hello. I'm just going to flip the camera around. Alrighty. People keep trying to request to live. We're not going to join. They're not joining this. Alrighty. Can we all see the questions? As soon as I get a yes in the comments, we will start. I just started A&P 1. That's awesome, Stephanie. Good luck this semester. Let's zoom in a little bit. Okay. Can we all see the questions fine? Then we'll go ahead and get started with number 1. Just a quick yes or a thumbs up will suffice. Yes, thank you, Maria. Thank you. All right, number 1, which prefix means absent of, without, or not? What is that going to be, A, B, C, or D? If you're new here, what you just do is you read the question, and then whatever you think the answer is, you put your answer choice of A, B, C, or D down in the comments, and then we'll go over it. We'll talk about why that answer is right. In this case, mostly just definition-based. Best way to learn your medical terminology, absolutely going to be flashcards. But hello, everybody. Welcome. I'll let a few of you answer while you guys are answering, and then we'll go ahead and give you guys the answer. But number 1 is C. Is the medical prefix an. So an means absent of, without, or not. Whenever you see AD, most of the time you can think of toward. And why is this going to be important? Because you think of adduction is toward the body. That's a type of movement. AB is away from. Abduction will be away from the body. Ante means before. I'm going to switch to my red pen. But number 2, the prefix AB means what? I did just explain that. That's why it's important to go through the answer choices and explain out loud and explain to yourself why the other ones are wrong. And oftentimes they can give away answers. But the prefix AB means I'll give you guys a moment to answer so that to just answer this one. But hopefully you were paying attention to the explanation. Perfect. It is B, or to away from, or to take away is the correct definition. Remember, abduction is away from the body. Number 3, the prefix AD refers to what? This is one of the similar ones that we just went over. What do you guys think this one is? Again, this is really important, why you go through and answer each question, or answer each answer choice within the question. Oftentimes, it does give away the answer. Number 3 is C. It is towards, to, or near. Remember, our adduction. Whenever we see opposing or against, you can think of anti or contra. Separated, let's see, I'm trying to make sure I'm not giving away apo. And then half would be hemi or semi. Number 4, which prefix means both? Which one means both? We're on number 4 now if you're just joining us. Welcome. If you are just joining us, hello. It's nice to see you all. My name is Ollie, and I go live multiple times a week covering anatomy and physiology topics that you guys all request. But today we're focused on medical terminology. I know a lot of people are starting their classes soon, and everyone always asks me, what's the best way to start? Making sure that you have the language of your courses down is going to help you kind of master all the other stuff. A lot of times terminology gives away answers. But number 4, the answer is B. I think if someone is ambidextrous, it means they can use both hands. Ante means before, meta was be beyond or change, and then sub is under. What about number 5? The prefix amphi means what? A, B, C, or D? A, B, C, or D? What do you guys think for that one? I'll give you guys a couple more seconds to answer, and then we will give you the answer. What gland secretes growth hormone? That would be the pituitary gland, specifically the anterior. It's going to secrete growth hormone and also your human growth hormone. Number 5, the answer is A. It is double or both sides. One would be mono or uni. Many would be multi or poly. Small would be micro. Number 6. Ana is defined as what? Hey, yep, they get sent after the live stream. Number 6, Ana is defined as what? ANA. What do you guys think for this one? Recommendations for remembering the hormones and what they secrete. Definitely the best way to do it is a flowchart. I have a video like that on my profile. I'll make another one here soon. Send me a DM. It's in the, you can hit the Service Plus button. I can make a video on that. Just request that video. Number 6, the answer is B. It is up or apart. And it is up or apart. Beyond or outside, it would be extra or meta. Half, again, like we mentioned, was semi or hemi. With and together, that'd be co or con or sim. Number 7, which prefix means before or in front of? A, B, C, or D? I passed my class. You're absolutely gonna crush your exams. I know it. I promise. Awesome. Fantastic. Number 7, the answer is D. It's ante. Before or in front of is ante. Post is after. Re is again or backward. Infra is below. Number 8, the prefix anti means what? What does that mean? A, B, C, or D? Any tips for reading the textbook faster? I can go with that closer towards the end of the live stream. I have a pretty good explanation for that one. Number 8, the answer is B. It is opposing or against. Anti is opposing or against. Around could be 2. We might go over one of those earlier, but around is circum or peri, like pericardium. Number 9, which prefix means self? When we're referring to self, what would that be? A, B, C, or D? Thank you guys so much for the follows, by the way. I appreciate all the follows. My next live is Saturday at 2 p.m. Eastern Standard Time. I don't have a specific topic for that yet. It'll probably be a mix of both anatomy and pharmacology. So you'll see some AMP1, AMP2, and a little bit of pharm. Number 9, the answer is D. It is auto. Anytime auto, it's self-regulating. APO would be separated from. Oligo, it would be a small amounts, and iso would be the same or equal. Number 10, the prefix bi refers to what? The prefix bi refers to what? A, B, C, or D? The answer is B. It's double, 2, or twice. So biceps, the biceps have 2 heads. Also, if you think of 3 triceps, it has 3 heads. Half, again, let me mention what is the hemi and semi. Many is poly or multi. This one is actually an interesting one that not many people really see. None is nully. Number 11, which prefix means short? I know a lot of people get this one confused, so I'll give you guys a second. Which prefix means short? A lot of students get this one tripped up, so I'll let you guys answer this one and we'll cover what each one means. We're on number 11 now if you're following along. Number 11, the answer is D. It's brachy. Brachy means short. Brady, we'll go over in the next question. Micro means small. So I know a lot of students will say either Brady or micro. Micro means small. Brady means, which we'll go over in the next question. Macro would be large. But moving on, speaking of Brady, number 12, which is it is defined as? What is Brady? A, B, C, or D? Fantastic. It is slow. I don't know if you watch American football. There's a guy. His name is Tom Brady. I don't like Tom Brady. I do admit that he's the GOAT of football, but he's not very fast. He's very slow. So that's how I just kind of remembered that one. So if you have bradycardia, well, you know what Brady means. Brady means slow. And we're going to refer to the heart. We're going to have a slow heart rate. The other opposite of Brady would be tachy. It'd be fast. Number 13 of the following here, which prefix means around? I did mention that a couple questions ago, so hopefully you were paying attention. The Brady Bunch, I like that. I actually haven't watched that, but I am familiar with it. Oopsie, no oopsies here. It's all right. It's okay. Also, thank you guys so much for we hit 5,000 likes on the live already, guys. Thank you. I appreciate that, guys. I appreciate the support. That means a lot. But as we move on to the next page again, my next live is Saturday at 2 p.m. Eastern Standard Time. And then all of my notes for anatomy and physiology, they are available in my TikTok bio. Number 13, the answer is D. The other one, again, can be peri. This also means around. Again, there can be some things that also mean the same thing. Infra is going to refer to below. Meta is beyond. If you think of I don't know if you guys play video games or not, but if you play video games, there's always the meta class. In a sense, it's beyond what is good. But number 14, the prefix contra means what? I also mentioned this a little bit ago, so hopefully you were paying attention. But number 14, the prefix contra means what? A, B, C, or D? Slides are everything. Thank you. I appreciate that. I didn't. The name went by. The emoji. Thank you so much. I appreciate it. That means the world to me. I love doing these live streams. They're my favorite part of my day. So I appreciate you guys taking the time to sit here and learn a little bit and practice with me and things. But thank you guys so much for being here. But number 14. We're on number 14 now. If you're following along, contra is C. So we're against or opposed to. A way that I always think about it, if you're like going on a plane, they always call it contraband. You're not allowed to bring it there against having you bringing it on the plane. Number 15, this is referred to or defined as what? What is this mainly defined as? A, B, C, or D? Got a 99 on my medical term final, 98 for A&P. That's awesome. Congratulations. That's incredible. Congrats. I remember for my medical terminology class, I got the date for my final exam mixed up. I didn't know that we were taking it the last day of class, not during finals week. So I showed up to the last day of class, like no willy-nilly. I thought we were just going to review for the final, and they were like, oh, open up your laptops. We're starting the final. I was like, dang, that's rough. That's rough. I got a 90 though, so no studying. That was definitely all the Lord on that one. Number 15, the answer is B. Bad, painful, or difficult. Think of, someone actually mentioned in the comments already. Dysfunctional is bad. It's bad to be dysfunctional, and we don't want to be dysfunctional. Number 16, the prefix ecto means what? A, B, C, or D. Man, I'm about to start medical school on Tuesday. That's awesome. Good luck in medical school. You're going to crush it, Daisy. This is the kind of content I need. To see more of Sega cut up scrolling and still learning. Yes, exactly. Yes, if you're definitely learning if you're here. And so I appreciate you being here. You guys are incredible. That you were already at 7,000 likes. I appreciate you guys with all the support. The more that you guys do like the live stream, the more that it gets it out to people. But number 16, the answer is C. It is outside, outer, or on. The way I also think about this is, so within, the opposite would be endo, which is a pretty big system. You have your endocrine system. Number 17, which prefix means normal? A, B, C, or D? And take a sip of my drink. Okay, so the questions here, I did not make this. So normally Mondays and Tuesdays, we go over information and concepts that we tested on the HESI and Ts for A and P. Today, I did not make this in mind with the HESI or Ts. Will this help? Yes. But did I make this exam in preparation for it? No. I try to cover a wider range of things. Sometimes I don't just do HESI or Ts. I try to make it for other exams and just your course in general. I start A&P 1 next week, and I'm so nervous. That's exciting. That's awesome. Good luck next week. You're going to crush it. We'll be doing A&P 1 lives every week. We go live 4 times a week. Our next live is Saturday at 2 p.m. EST. But number 17, the answer is B. EU. Neo means new. Mal means bad, which I believe in Spanish, mal means bad as well. If that's a good way to remember. Pseudo means false. I think I'm right on that one. I took AP Spanish, but it's been a while, but I think so. But number 18, the prefix hyper refers to... Yes, okay, perfect. Perfect. Number 18, hyper refers to what? A, B, C, or D? You guys are crushing it. Number 18, the A is A. It is above, excessive, or beyond. A classic example of this is hypertension, high blood pressure. Below would be hypo. So if we had low, we'd hypotension. Number 19, what prefix means new or recent? I just went over this one. Yep, there are plenty. Yep, hyperthyroidism, hyperkalemia, hypernatremia. There's so many. Fantastic. The answer is neo. A good one to remember this is neogenesis. This is new generation. I just went over this one as well. Number 20, the prefix pseudo means what? This is really important when it comes to, in terms of this word, this prefix. It's really important for histology as well. Pseudo means a false. So whenever you go into histology, you're going to learn about tissue, and a classification is going to be pseudo-stratified. Stratified means layered. So if it's falsely layered, it's going to give off the appearance that it has layers, but it actually doesn't. Number 21, we're kind of moving on to some of our word roots now. So kind of what system or body part we are referring to. You're taking histology this semester. It's awesome. Good luck. Number 21, the combining form, abdomino, is going to refer to what region? Again, when we have word roots, they're going to pertain to the body region or body system. EU was normal. And again, I do upload these to YouTube afterwards as well. And then also, if you would like to get a copy of the questions, you get the blank. It's the blank test and then the answer key at the end of the live stream. You just join our community here on TikTok. Once you join, you get the blank test and the answer key after every live. Once you join, just send me a DM letting me know. You take your ANP2 final. Good luck tomorrow. If we could get good lucks in the chat for the ANP2 final, that'd be awesome. So number 21, the answer is B. It's abdomen. It's going to refer to the abdominal area or your abdomen. A lot of students get this a little confused with stomach sometimes. Stomach is gastro. So gastrointestinal as a way to think about it as well. Number 22, andro is related to what? Andro is related to what? A, B, C, or D. Also, remember, I'll look through your questions and comments real quick. Kaylin said, just started my nursing program. This is a perfect brush up. That's awesome. Good luck in your nursing program this semester. You're going to crush it. Thank you, Pamita, for the sub. Please send me a DM so I can get you these questions. Thank you guys so much for the sub as well. I resuscitate. Please send me a DM so I can get you the questions after the live. You guys are awesome. Thank you. Then number 22, the answer is C. It is referring to male. This is really important, especially when you learn about hormones. You have androgens. Androgen hormone is a male sex hormone. An example of that would be testosterone. As this TEAS prep, not necessarily. This might help you a little bit, yes. But again, I did not make these questions with that exam in mind. Number 23, what combining form means vessel? Which one means vessel? A, B, C, or D? We do HESI and TEAS A and P prep every Monday and Tuesday. Do I have anything? Not necessarily for pharmacology. We do some pharmacology live streams. We're actually going to be, I will have some pharmacology questions on Saturday at 2 p.m. Eastern Standard Time. Number 23, the answer. So again, this one some people get this a little bit confused as well. Number 23, the answer is B. When we're talking about a vessel, we are referring to angio. When we're referring to arterio, this is artery. Cardi would be heart. And then C would be sight. All right. So again, always, that's why, yes. So when you refer, so we kind of mentioned this before, but genesis means to form. So if we have angiogenesis, this is going to be the formation of blood vessels. Number 24, I guess I gave this one away, which you guys get mixed up with. But number 24, the combining form arterio is going to mean artery. But what about vein? Where do you think phlebotomy comes from? There you go. Number 25, which combining form means joint? A, B, C, or D? Which combining form means joint? A, B, C, or D? Also, if you're just joining us, welcome into the live stream. My name is Ollie. I go live multiple times a week covering anatomy and physiology mostly, but today we're focused on medical terminology. We also do some bio, some chemistry, and some pharmacology here as well. It's nice to meet you all. I have my master's degree in molecular medicine, and I've been tutoring A&P for like 5 years now. It's almost 6. It's been kind of crazy. But number 25, the answer is B. It's arthro. If you think of arthritis, inflammation of your joints. The combining form audio refers to what? Yeah, we do occasionally some microbiology is here as well. Yeah, we can do some endocrine systems. Let me answer some of these questions real quick. Histology is a tissue. Yep, I take my T's on Saturday, so this is good practice. That's awesome. Good luck this Saturday. You're going to crush it. If we can get some more good lucks in the chat, that'd be awesome. Yes, we do some microbiology. Can we do endocrine system? We can do some endocrine system on Saturday. I'm taking AP next semester, but I learned this in midterm. Awesome, guys. Number 26, the answer is D. It is hearing. It's kind of, that one's a little bit obvious in a sense, hearing audio. Number 27, broncho is going to be related to what? Hey, yep, if you were interested in tutoring or you have any questions about that, send me a DM via the Service Plus button. I put up a little notification here. If this goes away, it stays up for like 30 seconds. It's in the bottom left corner there. It'll either say Service Plus or Sub. You just hit that, and then you're able to send me a DM during the live. That's what I go through if you're interested in tutoring or anything like that. Number 27, the answer is B, is bronchus, or referring to the lung. Kidney is always nephro. Blood is hemo. Chest is thoracic. Number 28, which combining form means cancer? Which combining form means cancer? A, B, C, or D? Also, we're at 11,000 likes on the live stream today, guys. Thank you guys so much. I appreciate all the likes and the support and all the comments and participation today. You guys are awesome, and I love you guys. It's always so much fun to do, so I thank you so much. Again, the more that you guys do like the live, the more that it gets out to people, so we can help out as many people as possible. I know a lot of people are starting classes either this week or next week in like 2 weeks or something like that. But number 28, the answer is D. Carcino. Encephalo is going to refer to your brain. Cysto could be referring to your bladder or a cyst. Chondro is going to be cartilage. Number 29, cardio refers to the what? A, B, C, or D? I appreciate your time and effort. I appreciate your guys' time and effort. Seriously, I couldn't do this without you guys being here, so thank you. But number 29, the answer is B. It is the heart. Cardiology, there's so many words with cardi in it, it's kind of insane. Encephalo is going to refer to brain. Number 30, which combining form is going to refer to our gallbladder? Which one is going to refer to our gallbladder? A, B, C, or D? And welcome everybody that just joined. Hello. There's over like 500 of you in here. Thank you so much for being here, guys. I'm Ollie. It's nice to meet you all. I have my master's degree in molecular medicine, and I've been tutoring A&P for 5 years now. I go live multiple times a week. The next live is going to be on Saturday at 2. This is Eastern Standard Time. We're on number 30 if you're following along. Which combining form means gallbladder? The answer here is C. My iPad is supposed to update today. And which is probably why my highlighting and drawing and pen isn't working as well. That's normally how it always works. Number 31, chondro is associated with what? Chondro is associated with what? Bacolo is going to refer to your colon. Thoracic, again, means chest. Laryngo, that's going to refer to your larynx. We're moving on to number 31. I gave this away a couple answers ago. A couple questions ago, so hopefully you were paying attention to that one. Sent you a message, perfect. I try to go through every question by either, I do get a lot of DMs after the live streams, about 200. So I try to get to everyone by either the end of the night or the next day, early in the morning. But number 31, chondro is going to refer to cartilage. We talked about site was cell, so if we say chondrocyte, we're referring to a cartilage cell. Number 32, the combining form colo is going to refer to what? Yep, I do have YouTube. I upload the replays to YouTube as well. I have also been working on some lecture videos. I just did upload my first medical terminology lecture video. There should be another one uploading hopefully this weekend. It'll go over prefixes. Then there's another one on the word roots. And then there will be a different one on suffixes. So you can go through. We can give examples and things like that. And then you can make flashcards if you'd like to do so with that video. Number 32, the answer is B. It is colon. Stomach, we mentioned a little bit earlier because we were mixing it up with the abdominal. Stomach would be gastro. Bladder was cysto. Uterus, hystero. That one isn't as frequently used as what I see. YouTube is linked in my TikTok bio. It's my name. You can just look up Ollie Hertzing. Thank you so much for the sub. Send me a DM so I can get you these questions after the live stream. Number 33, which combining form means bladder or cyst? I've been going over this one. I'll give you guys another moment to answer. I put two answer choices next to each other because I'd like to make sure that is kind of driven across a little bit. Sometimes dyslexia gets the better of you for this question. But this one is going to be our cysto. A. Cyto, again, refers to cell. Number 34. Again, I gave that one away. But it is cell. The combining form for cyto will mean cell. Number 35. Duodenal, this is going to refer to the what? A, B, C, or D. Which, by the way, if you do join the sub community, that is how you get the blank PDF with the answer key at the end after every live stream. Once you join, you just send me a DM letting me know that you joined, and then I will get you the questions. You will receive a copy after every live. We go live at least 4 times a week, and our next live is Saturday at 2 p.m. Eastern Standard Time. Number 35 is A. It's duodenum. The duodenum is the first part of the small intestine. Number 36, the combining form encephalo is going to refer to what? We went over that just a couple questions ago, and one of you did ask, so hopefully you were paying attention to that one. Awesome. We're at 16, almost at 17,000 likes, guys. That is insane. Thank you all so much. I appreciate you guys. Number 36. The answer is C. It's going to be brain. Nerve would be neuro. Vision would be opto. Testicle, this one, again, isn't as commonly seen. Number 37. Erythro is going to mean what? What does this mean? This is really important. A, B, C, or D for number 37. I'm using GoodNotes. Number 37, I'm moving on to the next page now. This means red. Why is this so important? Erythrocyte, what does that mean? It is a red, oh my goodness, I put a B. Red blood cell. Also, this is really important to know because you have 2 different types of formation when it comes to blood cells. And I always like to try to differentiate the 2. So you have hematopoiesis and erythropoiesis. Hemato, like we mentioned, refers to blood. Erythro refers to red. So, poiesis is a suffix that's going to mean making or producing or creating. So, hematopoiesis refers to general blood cells, producing general blood cells. Erythropoiesis is the formation and producing of red blood cells. I think that's why I feel like this is a really important word to know. Number 38, the combining form, esophageal, is referring to what? A, B, C, or D. We're almost at 20,000 likes now. Holy crap, guys. I just looked away. You guys are awesome. A, B, C, or D. 20,000. You guys are crushing it. Thank you guys so much. I appreciate you guys. Number 38, the answer is D. It's esophagus. Number 39. Now that we're here, gastro is associated with the what? What is gastro associated with? A, B, C, or D. Thank you so much, Virginia, for the finger hearts. Thank you guys so much for the gifts and for the subs today. Guys, if you did just join, thank you guys. I appreciate you. Thank you for being here as well. Number 39, the answer is A. Like we mentioned, was the stomach. Heart was cardio. Intestine would be your entero. Let me spell that right. Bladder, again, was the cysto. Number 40, the combining form for glyco means what? What does glyco mean? Number 40. A, B, C, or D. And then also all my anatomy and physiology notes whenever I was in the course, that is available on my TikTok bio. It's on my website. They are the notes from whenever I was in anatomy and physiology. I took it in both undergrad and graduate school. Number 40, the answer is C. It is sugar. Protein, most of those are like proteo, so if you think... fat would be normally lipo. Water, obviously, is hydro. Moving on, so those were the word roots. Again, I do plan on uploading a video, a lecture-style video, going over all of the common prefixes, word roots, and then now we're moving on to suffixes. So again, expect to see those videos pretty shortly. And then this will also be uploaded on YouTube as well, so you can go back and rewatch. Number 41, the suffix at the end of the word, AC, is going to mean what? A, B, C, or D? I do a video up on YouTube currently that's about like how to read, basically how to look at a word and kind of decipher it, and be able to recognize what's going to be your prefix, what's going to be your word root, what's going to be the combining vowel. And when we say the combining vowel, when we have this little slash and the O, it's mostly O, sometimes it can be other ones. That's what's going to be your combining vowel. I have a little train analogy that I use in the video. I think it's a great way to remember. In terms of bones and muscles, I do have a video. I actually just posted a video on that on my TikTok. If you wait till the end, I'll answer that in more detail just because I do have a long-winded explanation for it. Number 41, the answer is B. It is pertaining to. This one means pertaining to. So it indicates that it is related to something. Enlargement would be megaly. Inflammation is itis. Remember we said arthritis. Condition, normally IA. Number 42, the suffix algae refers to what? A, B, C, or D. Thank you so much for the finger heart. Thank you so much for the gifts, guys. You guys are awesome. Thank you, thank you. But welcome if you're just joining us today. It's nice to see you guys. I hope you guys are having a great Thursday. And again, the live stream, there will be another one on Saturday at 2 p.m. Eastern Standard Time. And then number 42, this one is going to be pain. D. Going to refer to pain. Number 43, what suffix means pertaining to? It means pertaining to. Perfect. Thank you, Maria. Thank you. Move the screen up a little bit like this or this way. Thank you so much for the rows. Number 43, the answer is C. Again, we have the AL and AC pertaining to and pertaining to. The suffix CELE means what? A, B, C, or D. For number 44, moving on to number 44 now. Awesome. You guys are crushing it. Number 44, the answer is B. It is a protrusion. Protrusion. Do we need an example of this one? I just want to make sure before we go. But do I have a video on nutrients? Not yet, but I will make one. If you want to request that video, send that. So I have a Service Plus button now that I'm going to put it up there. If there's any sort of video that you'd like to see, I'm going to start posting lecture style videos to YouTube, and I would absolutely be happy to make a video for you. But okay, an example. So perfect. So an example is hydrocell. So a hydrocell, again, hydro means water, cell means protrusion. So hydrocell would be a a fluid-filled sac that causes swelling. Mainly you would see this in the scrotum, mostly in infants, but again, is a protrusion due to water. Number 45, synthesis is defined as what? A, B, C, or D? A, B, C, or D? So remember this one would be a fluid filled sac. And again, you would not want obviously that fluid filling up that sac would cause the protrusion. Also, Maria, I saw your email. I will take a look at it after the live. Thank you so much for sending the message. I appreciate it. Thank you. Thank you. Awesome. Number 45, the answer is D. This is going to refer to any sort of surgery, withdrawal of fluid. Surgical removal, I think there's a question, yeah. So I guess I'll answer, well, let's skip around a little bit because I'd like to make a point. Synthesis, again, is going to refer to surgical withdrawal of fluid. Ectomy is going to refer to just a surgical removal. So I kind of skipped around there just to kind of drive a point across. But number 46, which suffix means to kill or destroy? Which one would be to kill or destroy? A, B, C, or D? So for destroying, thank you so much. I sent a message about a copy of the test. Perfect, thank you. I'll get to your message after the live. I always answer the subs immediately after the live. So if you did sub, I will be getting to you immediately afterwards. But number 46, answer is B. It is side. An example of this would be bactericide. So this would, again, this sounds like bacteria. So this would be destroying bacteria. Number 47, the suffix site means what? I actually think that was, well, cyto means cell. But this one is cell. This is not too similar. Sometimes I get a little tripped up with potentially repeating a question. But site means cell. Cyto also means cell. Number 49, which suffix means pertaining to blood? Which one is going to mean pertaining to blood? A, B, C, or D? I'm going to move on to the next set of questions here now. What do you guys think for that one? We're also at 32,000 likes. Oh my goodness. Thanks, guys. I appreciate you guys. You guys are awesome. Thank you. Thank you. You guys are incredible. Number 49, it is emia. Number 49 is emia. So when we're referring to blood, we're talking about emia. Number 50, the suffix gen would refer to what? Also doing good. Thank you. I appreciate that. Thank you. Thank you. I got you the lights. Thank you, Shayla. Thank you. I appreciate it. You guys are really crushing the like button. I appreciate it. But I'm very happy to be here. Yes, these live streams are, in fact, my favorite part of the day. I saw a lot more people join, but if you are new here, welcome. My name is Ollie. I do go live multiple times a week, at least 4 times a week, covering mainly anatomy and physiology. We do some other topics as well, but we're doing mainly anatomy and physiology. The next live is going to be Saturday at 2 p.m. Eastern Standard Time. But number 50, the answer is B. So when it ends in the word gen, it's going to refer to a substance that produces or causes something. Number 51, gram is defined as what? I post these lives to YouTube. It's linked in my TikTok bio. That's where you can find the questions at. And then if you would like to receive a blank copy of the test, you join the TikTok community. Once you join, just send me a DM. You get the blank test, and it'll have the answer key at the end. Basically, that you can take these tests, you can print them out, you can do them yourself, whatever you want to do with them. But if you want to just watch the replay or anything like that, that will be on YouTube. That normally gets posted a couple days afterwards, at least the replay. But the live stream, the blank PDF gets sent to you by the end of the night. Number 51 is a record of. Think of electrocardiogram. That's kind of the example that I use a lot with. True. If you go and watch my video on how to read medical terminology, this is the example I use, because you have electro, which is going to refer to electricity, cardi, and then there's the combining valve, the O, and then gram is a record of. So you're having a record of the electrical activity of the heart. Number 52, the suffix graphy refers to what? A, B, C, or D? I'll give you guys another moment to answer. Perfect. This is the process of recording. So a gram is a recording of, and graphy is a process of recording. That's the difference. Number 53, itis means what? Itis means what? You'll hear a lot of itises in your healthcare career, I'm sure. I wonder if there's a thing of like itis from hearing the word itis so much. But number 53, the answer is inflammation. We used an example earlier, arthritis. That would be inflammation of your joints. There's pericarditis. There's a lot of things with itis at the end. I'm telling you, there's so many places. You can have inflammation everywhere. Number 54, the suffix O just means what? A, B, C, or D. A, B, C, or D. These don't look similar to teased questions. Yep, I'm not doing a tease or HESI practice today. These are medical terminology questions. We do our HESI and tease practice on Mondays and Tuesdays. A and P1 on Monday, A and P2 on Tuesday. This potentially this will definitely help you for the tease, but again, I did not make these questions with that exam in mind. This is just, a lot of people always ask me, how do I prepare for anatomy and physiology? How do I prepare? The best thing to do is to learn the language. You gotta really understand these words. It gives away a lot of, it makes learning the information a lot faster. You don't have to stop and look up words and things like that most of the time, especially if you really get the terminology down. It's very important, very, very important. So that's why we do it. So yes, it might not be pertaining to a specific exam, but it's going to help you when you study for those exams. That's the point. 54 is a specialist who studies and treats disorders. Study of is logi. Record of, remember, was gram. Inflammation was itis. Number 55, megaly is defined as what? A, B, C, or D? A, B, C, or D? Eve said these are addicting. I'm starting nursing school and I'm enjoying tuning in. Thank you, Eve. That made my day. I'm glad that these are considered addicting. I appreciate that. That's probably like one of the better compliments I can ever receive about these. So thank you. That's so sweet. Number 55. The answer is C. It is enlargement. So if we were to say like cardiomegaly, we would say an enlargement of the heart. A growth is going to refer to like plasmaplasia condition, osis, and dropping would be, this one is apoptosis. Number 56, which suffix means resembling? A, B, C, or D? The HESI and TEAS are different exams, but in terms of anatomy and physiology, I really don't believe there's too much of a difference in terms of the concepts that are tested on there. So it's kind of why I try to teach them at the same time. I don't give you the exact questions that are on the HESI and TEAS. That'd be cheating. That's not the point. The point is to teach the concepts so that you don't have to memorize questions and answers. You really understand the material. And not only just like, I don't want you to just pass your class. I want you to ace it. That's really the goal. Number 56. Answer is oid. It's going to mean resembling. Osis is an abnormal condition. Oma is a tumor. I wish I just gave that away. Oh my goodness. I do that a lot. I'm so sorry. Number 57. The suffix oma is going to refer to a tumor. So a carcinoma. It's a cancerous tumor. Paralysis. This one is Misha. Flow. Well, I don't mean to do that. Rhea. That's why when you're talking about flow and Rhea, diarrhea, inflammation was itis. Number 58, pathy is best defined as what? A, B, C, or D? What do you guys think for that one? Number 58, last couple questions here. And then I'll flip around the camera. If you guys are new, you can see my face and I can say hello to you guys and officially meet face to face, or see you again if you're a regular here in the live streams. If you are a regular, I do try to remember your name when your name pops up. I saw like a couple people already in here. Maria and Beat Ups, it's good to see you guys. You guys are always in here. Number 58, pathy is going to refer to B, a disease or a form of an abnormality. Formation, plasia, or plasm. Flow or discharge, like we mentioned, was the urea. And then to stop, this is stasis. And then number 59, the suffix pina, it means what? A, B, C, or D. I'm going to also do this just so I can scroll down a little bit more. Last two questions here, everybody. We'll speed through these. Number 59, the answer is D. It is a lack of or a deficiency. And then number 60, last question. Plasty refers to what? A, B, C, or D? And while you guys are answering, I just want to thank you guys so much for joining today. I appreciate you guys. I think we hit like 44,000 likes. That's insane. I know a lot of you were here if you were here the whole time, definitely put a little hands up that you were here the whole time. That's insane. I appreciate you being here the entire time. Again, the next live stream is going to be on Saturday at 2 p.m. There's going to be a mix, a little bit of everything. There's a lot of stuff that you guys have been messaging me about all week. I'm going to try to cover everybody's topic. Yes, Maria's been here the whole time. I wish. 2 p.m., we're going to go over some A and P1, some A and B2, and a little bit of pharmacology as well. Last question here is A surgical reconstruction. Measuring symmetry to view biopsy, so a biopsy. Crushing would be trypsy. Thank you, Akua, for the sub. Thank you. Yes, you can watch the videos on YouTube. They are linked in my TikTok bio. If you would like to get the blank copy of this, you just join our community. I'm going to put the little notification for it. You just join down here. Once you join, send me a DM, and then you'll get the blank test, and then the answer key will be at the bottom. And then you can go over this. You can do this at your own pace. You can print it out, do whatever you want to it. Things like that. Other than that, it'll be put up on YouTube in a few days, but I am going to flip the camera around and say hello. My hair didn't get flat. My hair did get a little flat. Let me put my light because it's so dark today. It's very gloomy and dark and cloudy, which unfortunately is the result of, I believe, a hurricane. But hello, everybody. Hello. Hi, everybody. Thank you guys seriously so much for being here. You guys are awesome. Nope, this is 2 p.m. Eastern Standard Time. My name is Ollie Herzig. It's also linked in my TikTok bio. You can also hit the bottom left corner there and send me I can send you the link to YouTube, but it is just in my YouTube video. Didn't ask if you're feeling me. I am, yes. I don't know what it was. I was fine. Tuesday, I felt awful. I woke up, I had like a headache. My eyes were like throbbing, and then I felt like the normal like getting sick thing. I felt hot, I was sweating, and then I woke up on Wednesday and I was like, oh, I'm perfectly fine, which is weird. You get a little false alarm. Thank goodness I'm okay, but thanks for asking, Maria. I appreciate that. You're covered, Ollie. Thank you. Awesome, guys. Thank you so much. Let me make sure I didn't miss any questions. If I look over this way, I just have my laptop up here. I use it to keep I load up on the vitamin C. Yes, I did load up on my vitamin C. Thank you so much. Appreciate you. I appreciate you guys for being here. Thank you. Let's get to 50K. And that's incredible. I appreciate that. That means a lot. But thank you guys. Also, please feel free if you have anything that you would like me to go over on Saturday. It's Ollie Herzig. It's available in my TikTok bio as well, the YouTube channel. The replay will be on YouTube eventually. Normally it goes up after a couple days. Sorry, I had a little hiccup. Can I go for the heart? Yeah, absolutely. Cloud, good to see you again. Thank you for being here. Excuse me, I got the hiccups all of a sudden. Thank you guys. Seriously, you guys are awesome. It's good to see you guys again. I love seeing your guys' names pop up. But seriously, thank you. I appreciate you guys being here. This is the first week back. I was on a little bit of a vacation, so we're back. Again, we're going live at least 4 times a week. If I will, Get Tessie's email. Yes, Val, they will. I think I got your email. Would you? Let me make sure. I have your name. Have you been getting them? I just wanted to make sure that you were getting them. I'll take a look at your direct messages and just afterwards as well, just to make sure. Yes. Okay. Perfectly. Thank you so much for the sub, Shaquila. Thank you so much. Thank you, D-Strip. Thank you so much. Please send me a DM, guys, so I can get your guys' emails. Again, the sub community, it's in the bottom left corner there. It's the thing with the star on it. Once you join, just send me a DM. I'll get you the questions. Again, it's just a blank test, the answer key at the end. Can you go over some heart diseases and control coronavirus? Yeah, we can put those in there. Old videos on tissues. Yeah, there are some old videos on tissues. Yeah, I do have some TikTok videos as well. I think if you go to my playlist, I think I have them organized under a playlist on TikTok. But if you go to the YouTube, they're in there as well. But again, I'm planning on doing some lecture style videos here coming up. So hopefully I can get a tissue video up soon. I'm working on the medical terminology ones. Again, I know a lot of people are starting class and a lot of people are asking me how to prepare. Medical terminology is the easiest way. I took medical terminology at the same time that I took anatomy. I did biopharmacology. Yeah, we're going to do some pharmacology on Saturday. I do love pharmacology. I was a pharmacy technician for 4.5 years while I was in college. So I do love my pharm. So we'll definitely have some pharmacology questions in there. We're probably going to have a little bit of mix on Saturday. So big mix, a lot of different things. Thank you. Yeah, seriously, thank you as well. Eve, appreciate you. Thank you guys so much for being here. I know I keep saying thank you, but I know I'm a broken record when it comes to the thank yous, but I really honestly can't say it enough. But I'll stick around here for a couple minutes if you guys have any questions or anything like that. So I do have to get going at some point here soon, but I will stick around if you guys just have any just quick questions, any like housekeeping stylish questions. And then Saturday again, 2 p.m. I'll be back. But if you joined the live stream yesterday, I got interviewed by TikTok, basically sharing how I use TikTok to teach anatomy and physiology and things like that. They're a great group of people. I love the TikTok live crowd. There's Nelson, Claire, and Catherine. They're the most wonderful people in the world. They've helped me a lot try to make these live streams better, to make it a lot easier for me to teach as well. So you can definitely thank them a lot for making these live streams a lot easier to do. Do a session, MSK, muscles, nerves, tendons, bones. Yes, absolutely, Maria, for sure. Definitely send me, I know we DM, send me that in a DM as well, so I can, I go through the DMs afterwards and I write down everything that people request. Switching covers the first time here. I was driving, so not typing much, but nice to be able to watch and listen. I appreciate you watching and listening. That means a lot. Thank you. Hopefully we can get you in here and you can do some questions with us as well, too. But that's awesome that you were listening. I appreciate that. What do you recommend to do A's, A and P, other than course study? I'm scared for this semester. Okay, so anatomy and physiology. Typically, when it comes to A and P, the best way that I can describe how to study. So anatomy is what and where things are. So what things are really just terms, definitions. I always recommend flashcards for things like that, like kind of the medical terminology. And then when it comes to where things are, practice labeling. Practice. If you have any diagram in your class, lecture, lab, textbook, print them out, label them. Know it like the back of your hand. Thank you, Lauren. I appreciate you. Know them like the back of your hand. Also, some people, you'll start anatomy and physiology with your directional references, learning superior, inferior, distal, proximal. Learn those terms and then learn how to describe these structures in relation to one another, because sometimes your professor might not give you pictures. They're just going to ask you where something is in relation to another structure. You're going to have to know not only just where those are from your memory, but also how to describe them as well. Physiology is the process of how things function. And whenever you think of processes, the best way to remember processes is to explain them out loud. In the same sense, if I were to ask you how to make a peanut butter and jelly sandwich, you're not going to memorize how to make a peanut butter and jelly sandwich, right? You're going to tell me how you make it. You're going to grab the bread. You're going to grab the butter knife. You're going to grab the peanut butter and the jelly, strawberry jelly, I hope. And then, get it out, scrape it on. And the same way, you want to practice explaining that, like you would explain blood flow to the heart. You would explain the pathway of food through the digestive system and things like that. Any sort of process, That doesn't necessarily, it's pretty obvious it's not something that you're going to be able to really memorize. A key thing there is muscle contraction. A lot of people think that they can memorize all the different steps of muscle contraction off rip. I disagree. I think it's definitely guava jelly. I've never tried that. I'm a grape jelly hater. I don't like grape jelly. It's best to go through muscle contraction, going through the motor neuron, where the vesicle calcium gets the vesicle and the action potential. It's best to explain that and be able to describe that. If you can explain things out loud to somebody else without looking at your reference material, active recall, you know the material. And that's just the best way to study physiology. You can do the practice questions. Yes, you can. Those help. Memorizing physiology doesn't. Sometimes, yeah, it depends who you are. But for most people, I would say no. I think practicing. I was lucky enough that I had a really great study partner. I don't have many more. Well, my friend, I shouldn't say I don't have him anymore. We're just not in class together anymore. But eventually I went on to do my master's degree and didn't have him. He went on to another school. So I had a stuffed shark. He got dirty and I had to throw him out. But Sharky, man, he knew before he was gone in the dumpster. Man, he could tell you a lot about physiology and pathology, and things, and molecular medicine, cancer. He could tell you a lot. I can tell you that right now. In a sense, I do have, I guess, an example of explaining something, especially blood flow. I do have my little heart here. In the same sense, you would practice going through your superior and inferior vena cava into your right atrium, right ventricle, through the tricuspid valve, and then through your pulmonary valve, up to the pulmonary trunk, pulmonary artery, lungs, and just continually practicing doing that. Awesome. Any other questions? I do have to get going here in like a minute or so. But hopefully, does that help describe how to study? I do not know who that is. Any other quick questions before I get going? Any other thing? Yes, thank you. No problem. Yes. Yep, we can go over a little bit of that on Saturday as well. Anything else before I get going? Thank you. Yeah, thank you guys so much for being here. You guys are awesome. Yeah, seriously, you guys are awesome. I love doing this. YouTubers for physio. Honestly, my favorite YouTuber is Ninja Nerd. He was clutch for me when I was in college, for sure. Hopefully I can, I aspire to hopefully make videos that are just as helpful. How do I remember the diagram of all the heart contractions? Honestly, drawing it out and practicing, going through each different action, electroactivity, and what is going on in there. He really, yeah. I know Dr. Mike. Dr. Mike is good. I'm trying to think of who else. Those are really the only ones I ever had to watch. I know there are definitely other ones. I'm definitely not saying those other ones there aren't people just as good. But that's who I used was mainly Ninja Nerd. Dr. Mike is also good too. I've watched a few. I think crash course videos are good, but I don't think crash course goes into too much detail, if I remember. Alrighty, if there aren't any other questions, I am gonna get going. Hey, Chris, how you doing, Chris? Thank you guys so much again. I'll be live again on Saturday at 2 p.m. Eastern Standard Time. Real quick, if you did want to get the blank question PDF with the answer key, you do so via joining the TikTok sub-community. Once you join, just send me a DM. Chris said, what's up, my favorite tutor? Not much, man. We went over some medical terminology today. I was one of my favorite students. Oh, you missed it again. I miss you. I missed you too. It's good to see you again. Hopefully we'll be live again on Saturday. Hopefully I'll see you on Saturday. Can't believe you missed it, SMH. That's disappointing, Chris. I was expecting you to be here. That's okay, though. But anything else, I think I'm going to get going. Again, thank you guys. All my A&P notes are on my website. They're linked in my bio. I want to go live. So I'm going live on Saturday at 2. And then next week should be Monday through Thursday. Or I have to take a look at my schedule. But at least Monday and Tuesday, it'll be 3:30 p.m. Eastern Standard Time. Yep, next time, Chris. Alrighty, guys. Have a great rest of your day. You guys are awesome. Thank you, guys. See you guys in the next